Good morning and welcome to today's web seminar. This is Simone Turek-Lee with John Burton Advocates for Youth. I think we're going to give folks just one more minute to get to join us, and then we will start the webinar. All right, good morning again. Thanks for joining us on today's web seminar. This is Simone Turek-Lee. I'm with John Burton Advocates for Youth, and today we're going to talk about two programs. So you are here for the webinar, A Tale of Two Programs, the status of youth in the rollout of HAP and Homekey during the pandemic. Before we jump into content, I'd like to just go over a few of the technical details for those who might, not be so familiar with GoToWebinar. Maybe you've become a Zoom expert, but maybe are still shaky on GoToWebinar. So if that's the case, the way this works is you have two options. You can call in or you can join through your computer speakers. So if you're on your computer speakers and you're having any audio trouble, one way to troubleshoot is just to use your phone instead and then follow along for the visuals on the computer. The call-in information is on the screen, but it's also in your control panel. If you uncollapse the audio section, you'll find it throughout the webinar. We always do a question and answer session at the end, and we encourage you throughout the webinar to submit questions through the questions drop-down panel section and also comments. If you have thoughts and you want to add to what we're sharing, please send those as well. And we post these materials, both the recording of this is being recorded, so both the recording and the PowerPoint slides will be posted on our website, www.jbay.org. It'll be under Training Archive. And then we'll also send all of those materials to everyone who registered for the webinar later today. So, diving in here. So we released a new report, John Burton Advocates for Youth. We released a new report, and it includes findings about the status of youth in two state-administered programs addressing homelessness. So that would be round one of the Homeless Housing Assistance and Prevention Program, or much less wordy, just HAP, and then Homekey, which was one of the programs that was launched in response to the pandemic in our state. And this report is available on our website. I believe Anna, who's joining me today, is also going to drop that link into the chat for those who want to kind of, pull it up while we're on the webinar here. And, we'll go into a background on each of these programs for those who might not be too familiar with them. For people who are familiar, you might already be thinking, what's the difference between these two programs? HAP had specified funding for youth. Homekey was a program that was pushed out very quickly and that projects applied for. These are two very different programs. You're absolutely right. And that's really the premise of this for this report, is really to look at them side by side, understand how they're different, understand how they did or didn't serve youth, and then consider, you'll see in the recommendations section, kind of considering how we might apply a youth set-aside concept to a program like Homekey. So during the recommendation section, we'll talk about that. And again, we'd love to hear from you. So kind of as we go through the webinar, please do enter questions and comments into the chat. So today, as I mentioned, I'm joined by my colleague, Anna Johnson. Again, I'm Simone Turek-Lee the Director of Housing and Health at John Burton Advocates for Youth. Anna Johnson is our Senior Project Manager, also focused on housing and health. And then we'll later today briefly be joined by Sharon Rapport, who is the Director of California State Policy for the Corporation for Supportive Housing. So she'll be joining us toward the end to talk about a proposal under consideration by the legislature related to homelessness and youth homelessness. So let's go over today's agenda. So we're going to provide some background information on youth homelessness in California. Then we'll talk more in depth about HAP. We'll talk about Homekey. Then we'll go into the contents of the report. We'll talk a little bit about the methodology. We'll really cover the findings for both programs and the recommendations. That's where we'll spend the majority of our time today will be on the findings and the recommendations. And then we'll have a brief section at the end for how you can get involved if you'd like to get involved with you supporting or participating in advocacy for current proposals to address youth homelessness that are under consideration by the legislature, the state legislature right now. And then we will talk briefly about a youth survey, and we'll do our question and answer session at the end. So let's dive into the background here. Like I said, first we'll talk about youth homelessness, then we'll go into more information about these programs. So youth haven't received their fair share of homelessness funding. You know, youth are a significant yet commonly overlooked segment of the homeless population in California. They, according to the 2019 point in time count, they represent 9% of the state's homeless population. We just looked at the numbers for the 2020 point in time count, similar percentage there. And over the last 3 years, unaccompanied homeless youth have averaged 10% of the total number of individuals experiencing homelessness in California. So that's about the level that we're really looking at over the course of really the last 3 years or over the course of the last 5 years. And, you know, while this level of homelessness is considerable, there's you know, youth homelessness has really not received its fair share of homelessness funding. So you can see that on the left-hand side there with the graph, you know, just 2.6% of federally funded homelessness beds, so of HUD, you know, the U.S. Department of Housing and Urban Development, the funding that comes to California. In 2019, just 2.6% of that funding, you know, provided slots for homeless youth. And that's compared to, like I said, in 2019, youth made up 9% of the homeless population. So we know that that's not proportionate. And, you know, the prioritization of chronic homelessness among adults really by HUD has been, I'd say, you know, a big part of this. We also know that there are issues with the way that people are screened into services to receive homelessness. Often the screening tools aren't very youth-friendly. We know that youth need specialized services. That's not always available. So we could do probably 10 more slides on this, but just wanted to scratch the surface and really point out that while we really have a large population of homeless youth here in our state, we are not adequately directing resources in youth direction. So as you all, I'm sure know, you know, times are hard for everybody. What we have found is that youth experiencing homelessness are facing special and significant challenges during the pandemic. So, you know, unlike most adults, homeless youth are experiencing the pandemic really without the financial and economic support of an extended family. And, you know, while experiencing that, they're having basic needs insecurity. So we know that they are in the age kind of range that's most impacted by job loss. And in October 2020 study, we learned that youth experiencing homelessness, that COVID-19 is negatively impacting their ability to meet basic needs and obtain services. And the most significant reported impacts were difficulty finding or keeping a job, accessing mental health services, getting enough food to eat, and then finding or keeping stable housing. So it's really, really a challenging time for youth that are experiencing homelessness to not have the support of an extended family. And we also know that certain groups of youth are at a greater risk of homelessness, and that includes youth of color and youth who identify as LGBTQ. A national study conducted by the University of Chicago found that LGBTQ youth had a 120% higher risk of reporting homelessness, and African American youth had an 83% increased risk of experiencing homelessness, and that's even when comparing with, even when income and education were controlled. And then Latino youth were also more likely to experience homelessness with a 33% greater risk. So, really, recent progress to address youth homelessness. While youth have not received their fair share historically, there's really been some exciting developments over the last, 3 years. So each of the last 3 state budgets have included significant investments to address homelessness, and they each had a specified minimum youth set aside. So in 2018-19, the Homeless Emergency Aid Program was launched, and that was a $500 million program. And of that $500 million, 5% was required to be directed to addressing youth homelessness at the local level. So every jurisdiction that received funding had to put at least 5% of their funding toward youth homelessness. And so statewide, that's a minimum of $25 million. In 2019-20, really based on kind of how successful the youth set aside was, the next program that was launched also included a youth set aside. So next we saw the Homeless Housing Assistance and Prevention Program, which is one of the programs we'll be talking about today. And that was round 1, and it was $650 million and 8%. So they upped the percentage, 8%. So a minimum of $52 million was put toward youth as the youth set aside. And then another round of HAP, round 2 in 2021, was funded at $300 million. And this was kind of, after the pandemic hit. And again, 8%, so a minimum of $24 million went toward youth. And we've learned a lot from both programs at this point, but kind of before issuing this report that we're talking about today, we learned a lot from HEAP. We surveyed jurisdictions in 2019 and 20 and found that they invested or intended to invest more than double the minimum requirement. So they didn't invest just 5%. Collectively, statewide, they invested 10.7%. So that was really exciting. We also just saw that the Homeless Coordinating and Financing Council released an annual funding report last month, and it showed that 9.2% of people served by HEAP were youth. So we know that youth set-asides are proving themselves to be effective, and so that was what pushed us to do this report and really look into how the youth set-aside was mapping out in HAP. So let's move on to HAP now and provide some background here. So this is a program that's administered by the Homeless Coordinating and Financing Council, and that's within the California Business Consumer Services and Housing Agency. And it's a block grant program. It's designed to support regional coordination and expand or develop local capacity to address homelessness. And it was funded, like I said, with $650 million for round 1. And today's presentation and the report is focused on round 1, not round 2. And there were certain eligible applicants. And so there were 3 kind of what's referred to as administrative entities that could apply for HAP funding at the state level. And then they, in turn, go and they can administer that funding locally. So that was the state's 44 homeless continuums of care, and they could apply for collectively up to $190 million could be allocated to them. The state's 13 largest cities, and so that was the cities those were the cities with populations of over 300,000, and they could be allocated up to $275 million. And then the state's 58 counties, but 57 were actually eligible, and they could be allocated up to $175 million. And then HAP, again, there was a set aside. So jurisdictions were required to spend at least 8% of their total HAP allocation on addressing youth homelessness at the local level there. So eligible uses. So I'm not going to, read all of these in detail, but you can see, the idea here, the Homeless Coordinating and Financing Council identified 8 eligible uses that they viewed as evidence-based, and then focused the eligible uses around those eight interventions. And so it's, rental assistance and rapid rehousing, operating subsidies, landlord incentives, outreach and coordination, systems support, delivery of permanent housing and innovative housing solutions, prevention and shelter diversion, and then in some cases, navigation centers and emergency shelters, and that had to be based on demonstrated need. So a pretty broad range of uses there. And so just to kind of go into a little bit more detail on how the funding is administered, because I think this is important. Again, it flows from the state to these 3 administrative entities. So the continuums of care, the large cities and the counties, and then they turn around and they have their own local process for administering the funding to local contractors in most cases. In some cases, they may have like a continuum of care, may offer something directly, but in most cases, we're looking at this funding being going into local contracts. So Homekey, let's provide a little bit of background on Homekey here. So in response to the COVID-19 pandemic, California launched first Project Roomkey, then subsequently Homekey, to protect those experiencing homelessness who are at high risk of serious illness and are impacted by COVID-19. So Project Roomkey was, I'm sure you all remember seeing all this in the news if you weren't following it, otherwise. Project Roomkey was established in March of last year to really provide non-congregate shelter options for people experiencing homelessness. And then subsequently Homekey, the NOFA for Homekey was released July 16th, really as the next phase of COVID-19 homelessness response. And Homekey provided grants to local public entities. So this includes cities, counties, housing authorities, federally recognized tribes. And $600 million was first allocated in that July NOFA, of which $550 million was derived from California's direct allocation of the federal coronavirus aid relief fund, CRF, that federal funding. And then $50 million of that was from the state general fund. Then an additional $200 million in the CRF funding was allocated in October, along with $46 million of philanthropic support. So total, we're looking at $846 million in Homekey funding that was pushed out at a very quick speed last year. The CRF funding had to be spent by December 30th, 2020, as required by the federal government. So that's why there was such a press on getting this funding out. And as you probably know, Homekey did not have a strategy for kind of ensuring or promoting the directing of funding towards youth-focused projects. It went out in a very different way than a program like HAP, where every jurisdiction received an allocation. In this case, it was really up to individual entities to apply for the funding directly to the state, and not every there was no requirement that those projects applying serve youth. So eligible uses. So the eligible uses for Homekey are certainly much narrower than HAP. It was really intended to be, acquisition and rehabilitation of buildings that could serve as, interim or permanent housing. So the uses were slightly broader than that, but that really was the focus. And it certainly was marketed with that focus. So this includes, acquisition or rehabilitation of hotels, motels, and hostels. And I think this was the most this was what people associated Homekey with the most. Master leasing of properties, acquisition of other sites and assets, and you can see kind of the whole list of what that entailed. Conversion of units from non-residential to residential, in a structure with a certificate of occupancy as, a hotel, motel, or hostel. The purchase of affordability covenants and restrictions for units, and then relocation costs for individuals who were being displaced as a result of the rehabbing. and then capitalized operating subsidies for units purchased, converted, or altered with certain funds. And so this, there were certain eligible uses that were only able to be, the state general fund could be used on those, but the CRF funds had to be used on the things that could be pushed out very quickly. So let's move into the contents of the report here. So first we'll briefly go over the methodology, then we'll go straight into findings and recommendations. So first we're going to really talk about, and actually this slide should probably have gone after the methodology, but first we'll talk about the methodology and then we'll jump into the Homekey findings. So we took a number of used a number of methods to gather information here. So on the left you see with HAP, we conducted an online survey and did phone interviews, and this is with representatives from continuums of care, cities and counties that received HAP funding. And the information that we gathered from these jurisdictions collectively, these jurisdictions that we spoke with received 80% of the HAP funding. So we really had a goal of gathering information from jurisdictions that accounted for the majority of the HAP funding. So we didn't talk to 100% of these jurisdictions, but we really wanted to get the vast majority kind of on the level of who received the most funding. And so that included 20 CoCs, and so they collectively received 93% of the CoC funding. It included 9 cities, they collectively received 88% of the city funding, and then 17 counties that collectively received 79% of the county funding. And then for the remaining 20% that we didn't gather information from, we referred to information from their applications to the state to be able to fill in the gaps. And then on the side on Homekey, we conducted an analysis of the publicly available Homekey award information that was on HCD's website. And we conducted interviews with a select number of representatives in jurisdictions receiving funding and project applicants. And so I want to take a moment here and just acknowledge, first the continuums of care, the cities and the counties, the representatives from the jurisdictions that we spoke with were so, helpful. And, it's such a busy time. We're in the middle of a pandemic. We knew that this, there are priorities certainly that they were tending to. And so we just appreciate all of your time and the information that you shared. I also just want to acknowledge social change partners. They assisted us with conducting this research and also with the HAP and some of the Homekey research. And then Anna Johnson, who's on this webinar, conducted the Homekey research and performed the analyses. So I just want to say thanks for this great team effort here. So let's jump into the HAP findings. So statewide, jurisdictions are collectively investing 10% of total HAP funding in addressing homelessness among youth, above the required 8%. So in the first round of funding, a total of $618 million in HAP funding was allocated. This table shows the amount allocated to each of these groups, and then the proportion of that funding that these jurisdictions are directing to youth based on what was reported by the contact at the CoC, city, or county, or for, like I said, for those we didn't survey, the amount stated in their application to the state. So, in some cases, a jurisdiction may state they intend to invest 8% in their application, but then in actuality, they may end up awarding more funding to youth organizations. So, this, picks up on more than just what's in the application and really what their intentions are or what their plans are or what they've done to date. So in total of the $650 million, you can see they weren't awarded the entire $650 million. So they were awarded $618 million, and then $32 million was retained by the state for administration, and then a very robust technical assistance plan that they'll be rolling out to local jurisdictions. So when we look at the amount of funding each jurisdiction is directing to youth, that collectively adds up to $62 million, or 10% of that $618 million that was allocated. And so this 10%, again, it's either what they have invested, what they've committed, or what they've stated they intend to invest. And then just to note, so in case this comes up over the presentation, in total, 102 jurisdictions were awarded funds. So really what you're looking at here, it includes 39 of the 44 eligible continuums of care, 14 large cities instead of 13, and then 49 of the 57 eligible counties. And that's because 5 of the CoCs and 8 of the counties, they redirected their allocations to partner jurisdictions. And we'll talk about that a little later. And then one city that was not initially identified as an eligible large city, and that's Palm Springs, did receive a direct predetermined allocation. So counties are directing a larger share of HAP funding to addressing youth homelessness than cities or CoCs. So we were interested in learning kind of which group of administrative entities directed the largest proportion of funding to youth. And so really you're looking right here at the same table that was on the last slide. And you can see that that group is counties. CoCs were allocated $168.2 million in HAP funds and collectively report investing or intending to invest $13.9 million or 8% in youth. Large cities were allocated $271.3 million and collectively report investing or intending to invest $21.9 million or 8% in youth. And then counties were allocated $178.6 million and report investing or intending to invest $26.3 million or 15% in youth, the highest proportion of the 3 jurisdiction types. So rental assistance and rapid rehousing were the most prevalent interventions funded by the HAP Youth Set-Aside, followed by outreach and coordination. So this table or graph illustrates the percentage of jurisdictions that are utilizing at least a portion of their youth set-aside funding for each of the 8 interventions. And this data includes that of 85 jurisdictions, which collectively received 92.5% of HAP funding. And one intervention is broken out into 2 categories, and that's the delivery of permanent housing, which is number 7 there, and number 9, innovative solutions, such as hotel motel conversion. So those are kind of considered one intervention, but we actually looked at them separately. So you can see there, rental assistance and rapid rehousing were the most common intervention category funded, with 50 jurisdictions, with 59%, investing youth set-aside funding into this intervention. And then the second most common category was outreach and coordination to assist vulnerable populations in accessing permanent housing and to promote housing stability and supportive housing. And that's 48 jurisdictions that represent 56% that were investing youth set-aside funding in this intervention. So 1/4 of jurisdictions are investing more than the minimally required 8% in addressing youth homelessness. So this table lists the jurisdictions that reported investing or intending to invest more than 8% of their HAP funding in youth. So they're all included there in the table. A total of 77 jurisdictions, or 75%, reported investing or intending to invest the required minimum, which is 8%, and then 25 jurisdictions, those you see on the screen, which 25% of them is what that equals, reported investing or intending to invest more than the required minimum 8% amount of funding in youth. And you can see, and so this is 8 continuums of care, which is, 21% of the CoCs, 4 cities, which is 29% of the cities, and 13 counties, which is 27% of the counties, exceeded the 8% youth set aside. And you can see that these figures range from 8.1% to 17.3% as far as what they're investing in youth. And then one jurisdiction jumps it all the way up to 93.5%, and that was San Diego County. So they invested the majority of their HAP funding in addressing youth homelessness. And they were awarded the Federal Youth Homelessness Demonstration Program grant. And so in their coordinated community plan, they identified a number of needs related to youth homelessness. And so they're using nearly all of their HAP funding, $9.3 million or 93.5% of their nearly $10 million allocation, to implement the Foster or Parenting Youth Initiative to provide longitudinal care coordination and housing for foster and parenting homeless youth who do not qualify for other housing efforts in the county or who may be newly homeless. So I just wanted to highlight that. It's also highlighted in the report because it's a really high percentage of funding, and it's great to see that they're investing in youth. So moving on to the next finding here. So jurisdictions located in the greater Bay Area or coastal region and the mountain regions of California were more likely to exceed the 8% youth set aside. So this table shows the proportion of jurisdictions that exceeded the minimum 8% youth set aside within each California region. And the California region with the highest proportion of jurisdictions exceeding the 8% youth set aside is the mountain region, but I just kind of want to put a caveat on that. You know, this region did receive just 2% of statewide HAP funding, so it's a very small percentage of funding overall, but you know, the highest proportion did exceed that 8% youth set aside. So nearly 1 in 3, 31% of jurisdictions in the mountain region exceeded. And then second to the mountain region is that greater Bay Area or coastal region, and that encompasses both the San Francisco Bay Area and the California coast. They received 26% of statewide HAP funding, and then 1 in 4, 25% of jurisdictions in this region exceeded the 8% youth set aside. And then the southern region really received the majority of HAP funding, and 1 in 5, 20% of jurisdictions in this region exceeded the 8% youth set aside. So of the 12 CoCs with the highest proportion of homeless youth, just 2 directed more than the 8% minimum to address youth homelessness. So this is significant because I think, you know, one might assume that the jurisdictions that are directing more funding to youth homelessness may be the jurisdictions where youth are a larger percentage of the homeless population. But that's not actually the case. So what we're looking at here is these are the 12 continuum of care regions that have the highest proportion of youth homelessness within the population of homeless individuals. And you can see how each of them directed funding to youth, what that level was. And so as you can see, Santa Rosa, Petaluma, Sonoma County continuum of care significantly exceeded the 8% youth set aside, investing, you know, they invested 17.26% of HAP funding in addressing youth homelessness. And then San Francisco City and County continuum of care just slightly exceeded that 8% youth set aside, investing, or, you know, is exceeding, investing 8.10% in youth. And San Francisco actually last year invested a significant portion, or not last year, but, you know, with HEAP, you know, invested a very significant portion. They were kind of almost at that San Diego level where they were putting a huge portion of funding into youth. And so I just want to state that. And so this year they invested 8.10% in youth. And those are the only 2 jurisdictions out of those 12 regions with the highest level of youth homelessness that exceeded the 8% youth set aside. So the last finding here, 13 jurisdictions collaborated to address regional housing needs. So I kind of alluded to this earlier, but jurisdictions had the option to apply jointly for HAP funds and then redirect their funding to a partner jurisdiction. And so a total of 13 jurisdictions, 5 continuums of care, and 8 counties redirected their funding, which totaled $19.5 million. And then 9 jurisdictions, you know, 4 continuums of care and 5 counties collectively received this redirected funding. So as you can see, all of this activity here in this table, these are all continuums of care and counties. So no large cities appear to have redirected their funding or received redirected funding. So they're operating, you know, a little more independently, it looks like, than some of the CoCs and the counties. So before I turn it over to Anna to talk about Homekey, I just wanted to, you know, we thought this was useful to include kind of quotes from the field. You know, these are sort of the next 2 slides. They capture some of the qualitative findings or really the sentiments that were expressed by people we spoke to at the continuums of care cities and counties about the HAP youth set aside. So one CoC representative said, "The youth set aside was absolutely critical. We were able to achieve a 40% reduction in youth homelessness from 2019 to 2020 because of it." A county representative said, "We used county general fund dollars for a previous youth program, but we would have had to wind it down if it hadn't been for the new allocation of dedicated funds." And then a county representative also said, "We had an almost shovel-ready project that we'd been envisioning for years, and we're finally able to move forward with the dedicated funding for youth." And then one more slide of quotes from the field. So a county representative said, "We only wish that the commitment to youth was made permanent. As it is, we're still worrying about how to sustain these effective programs into the future." And that was something that was talked about a lot. People really appreciate the one-time funding, but certainly we all know, I think, that ongoing funding is a more effective mechanism for addressing youth homelessness and homelessness generally, and for being able to, contract with providers to operate programs over time. So a county representative said, "Without the youth set aside, we'd still be trying to patch together resources." And then lastly, a city representative said, "For our city, unsheltered youth will always be a priority, but having the set aside keeps it at the top of our agenda." So now I want to pass it over to Anna, and she's going to talk about findings from the Homekey program.
Good morning, everyone, and thank you for joining us. And thank you, Simone, for all of your work on the report and presentation here today. I just want to remind everyone that all of these tables that are shown in the slideshow are in the report, and you can kind of see them there. I know it's easier to read on one screen on the report. Sometimes the slides can be small print, so definitely check out the report if you want to go deeper on and see what the slides are saying here. So to talk about Homekey, as Simone mentioned earlier, Homekey has provided over 6,000 units of housing for Californians experiencing homelessness during the COVID-19 pandemic. We analyzed the project's awarded funding to see how Homekey has served unaccompanied homeless youth who do make up 10% of California's homeless population over the past 3 years. Our first finding shows that less than 1%, 0.6% of Homekey funding supported projects explicitly serving youth experiencing homelessness. So just 0.6% of total Homekey funds, 2 out of 94 funded projects, were described as serving homeless youth. This included 2 projects, one in Riverside County that included serving LGBTQ youth, and a second in the city of El Centro to serve Imperial Valley College students who are transition-age youth experiencing homelessness or exiting foster care. So the service population that was awarded the greatest level of funding, this top row here, was individuals who are homeless or at risk of homelessness at 78.8%, followed by families experiencing or at risk of homelessness, and the elderly at 3.2%. When we talk about service population, this is who was specified in the award notification itself and the project description. And we broke those descriptions into 9 different service populations based on what we saw in those award descriptions. This doesn't mean that youth were not served in any of these other projects. We know there is a possibility youth were served in some of these other projects, and we conducted interviews with local jurisdictions. And to local knowledge, youth were not typically served, or if they were, they represented a very small number of the total individuals served by these other designated service population portions. Next slide, please. The most commonly funded Homekey project was hotel and motel acquisition, rehabilitation, or conversion. So we collapsed all of the eligible uses for Homekey funding here. And what we found was more than 6 out of 10, or 62% of the 94 projects funded by Homekey included acquisition, rehabilitation, or conversion of hotels or motels into interim or permanent housing. The second most commonly funded Homekey project was acquisition, rehabilitation, or conversion of other sites and assets, which could include apartments, homes, adult residential facilities, residential care facilities for the elderly, manufactured or pre-made housing, and other buildings with existing residential uses that could be converted to permanent or interim housing. So 1 in 3, or 33% of projects took this approach. 2% of Homekey projects included master leasing of properties, and 3% were unspecified in their application to the Housing and Community Development organization. So next slide, please. We found that more than 1 in 4 Homekey projects included the provision of supportive services. So while providing services was not an eligible use of Homekey funding, more than 1 in 4, or 29%, of projects awarded Homekey funding included the provision of supported services. Now, how that was done was by drawing on additional funding sources, including other state-administered funding, such as HAP, as well as private philanthropic funding. This includes the City of Oakland, which was awarded over $8 million to create 80 units of scattered site housing with supportive services, and the City of Sacramento, which was awarded over $4 million to create 38 units of manufactured housing for women and children escaping unsafe housing or experiencing homelessness with supportive services. We know supportive services are critical for supporting unaccompanied homeless youth with preventing and reducing homelessness and to get them out of homelessness. So we were really wanting to look at that. So next slide, please. HCD's approach to achieving regional equity with Homekey funding was effective and a potential model for ensuring projects serving youth are included. As Homekey was not a formula-funded program, it was ultimately dispersed across the state's regions based on who applied for and was awarded the funding. So, in an attempt to facilitate equitable distribution of funding by region, HCD divided the state into the 8 regions you see here, with each region having funding reserved on a time-limited basis during the priority application period. Based on each region's proportionate share of the homeless population, according to the 2009 point-in-time count, and the extremely low-income renter households in those regions that were paying more than 50% of their income for rent. So that's the approach that you're seeing laid out here. Now, this approach essentially established set-aside funding and could be employed to establish a youth set-aside in future Homekey funding. So figure 10 here, let's really take a look at this. It shows each region as divided by HCD, column A, along with the amount of funding that was reserved for that region during the priority period, column B and its proportion of the total reserved allocation, column C. The figure compares this reserved proportion to the actual amount of funding awarded to projects in that region, which is shown in column D, and the region's proportion of total Homekey funding, column E. In comparing columns C and E, with the exception of the Bay Area region, the overall funding is generally aligned with the proportions received for each of the 8 regions, with no more than a 4 percentage point difference. Now, the Bay Area region was awarded a proportion of statewide funding that is 12 percentage points higher than its reserved allocation. This may be due to the higher cost of housing in the San Francisco Bay Area region. Again, this is in the report findings and can be seen there as well. So next slide. Homekey did not fund homeless youth projects in regions with the highest numbers of homeless youth. So while HCD's priority period addressed regional equity, it did not include an approach to facilitate proportionate funding investment in serving youth. Homekey funds were not awarded in all parts of the state with high rates of youth homelessness. As noted in Figure 11, of the 10 jurisdictions with the highest levels of homelessness among unaccompanied youth, 1 jurisdiction did not have any Homekey projects funded, and that was Watsonville, Santa Cruz City, and County. And just one of those here described their service population as youth, so that was Riverside City and County identified LGBTQ youth as a service population in their Homekey project. And when we look at the other areas with highest levels of youth homelessness here, they did not specify youth. Next slide. So we do have some work to do to continue our research. As Homekey is a new project, we do want to take some time to learn more about our findings. And we want to kind of figure out from local jurisdictions and providers how to better serve youth should there be another phase of Homekey funding. So we're wondering why projects didn't apply and specify serving youth. So we're going to survey jurisdictions about this. And here are some things that we've heard so far from our interviews and anecdotally, and we'll get solid data on prevalence through a survey. So we have heard that youth, and we know youth have been absent from state and federal policy historically. Messaging for Homekey was focused on hotel and motel conversion, which is typically not seen as an appropriate, age-appropriate youth intervention. Youth providers may have lacked capacity to acquire buildings and identify those places, or have lack of knowledge about the application process itself. There may have been misbelief that another system of care is serving homeless youth. And I think in general, we're working on the accuracy of the point in time count for youth, but also jurisdictions and decision makers may be unaware of the size of youth homelessness in their community due to this historical exclusion of youth from federal and state policy. So we will survey and return with some of those findings. So I will now pass it back to Simone.
Thanks, Anna. So we're going to now go into the recommendations section of the webinar and of the report. And then we'll finish off the webinar with the take action section. So now for the recommendations. So the first recommendation is include a youth set aside in all future state investments in addressing homelessness, including Homekey. So youth set asides are effective. We've looked at HEAP, we've looked at HAP, and of the 102 jurisdictions that received HAP funding, 1/4, 25% are investing more than the required minimum 8% in addressing youth homelessness. And when we look at both HEAP and HAP, in total, a minimum of 5% was required for HEAP, but jurisdictions went to 10.7 or are going to 10.7%. And then in HAP, 8% was the minimum, and jurisdictions report that they're going to 10% collectively. And while this demonstrates an interest in ensuring youth needs are addressed, I think what we've also learned that, is that without an explicit youth set aside, youth are simply not served. When we look at Homekey funding awarded to projects explicitly serving youth, the level of that funding was 15 times less than youth representation in the population of homeless individuals, so 0.6%, as Anna outlined, as compared to 9%. And this lack of investment in accompanied homeless youth really mirrors what has historically occurred at the federal level. So, people might say, well, Homekey, it's a very different project. It was pushed out quickly. Projects applied. Why didn't projects apply serving youth? But when we look at what's occurred at the federal level, really, again, it's like prioritization of chronic homelessness among adults has been the focus. And so this results in few youth being served. In 2019, I said this earlier, just 2.6% of the homelessness beds in California went for unaccompanied homeless youth, despite the fact that in 2019, youth made up 9% of homeless individuals in California. So, Governor Newsom has proposed to invest, in his January budget, he had $750 million in there for Homekey that he's intending for the 21-22 state budget. And so it appears that Homekey is happening. And so, it's really important that all of us that want to see youth served really consider, how can youth be included in this investment? We know that the first time around, they largely weren't. We understand how that went down. We understand that there were timing constraints and limitations on how the federal funding can be used, but we have a really great opportunity right now to look at Homekey. The funding is different, the timeline is different. Look at Homekey and ask ourselves, how do we retool this a bit so that youth are part of this investment? So there we go. Slide was being sticky. So the next recommendation is require 10% of state homelessness funds address youth homelessness. So this is basically saying, okay, we know we want a youth set aside. What should the amount be? And from our perspective, based on HEAP, based on HAP, based on the point in time count, we think this figure, we think 10% as a minimum is a fair figure. Over the 3-year average and also over the last 5-year average, homeless unaccompanied youth make up 10% of California's homeless population. And this data comes from the point in time count, which is designed to measure, honestly, quite literally measure homelessness among adults, chronic homeless adults predominantly. And youth were just included in this count, somewhat recently. And so it's certainly an undercount. I don't think anyone would argue and say it's not an undercount. So the idea that 10% be a minimum is certainly a reasonable ask. I think we know that for both HEAP and HAP, 10% for HAP is being invested, 10.7% for HEAP is being invested in youth. It's demonstrated that this is a reasonable amount to direct toward addressing youth homelessness. So the next recommendation is utilize the same approach taken to facilitate regional proportionality in Homekey funding to establish the Homekey youth set aside. So the federal CRF portion of Homekey funds were required to be spent during the calendar year by December 30th, 2020. That was that was so much funding to push out in such a short period of time. And so with this severely expedited timeline, HCD administered the funding by awarding funds to jurisdictions that applied and were prepared to quickly utilize the funds. That's kind of what they had to do. And while this approach was procedurally effective, they understood it risked inequitable or disproportionate distribution of funding relative to regional proportions of homelessness. So the way that they remedied this, Anna described earlier, HCD developed a strategy of setting aside funding for each region. So there were regional set-asides that were based on their share of the homeless population according to the PIT, and based on extremely low-income renter households that are paying more than 50% of their income for rent. So they set, each region had a set-aside of a specified amount that was reserved for a priority period. And as Anna shared, this was an effective approach. It was relatively effective for achieving this regional equity. So given the effectiveness of this approach in facilitating equitable distribution of funds across regions, we really believe that the same approach could be adopted for youth, whereas 10% of Homekey funding would be set aside for a priority period during which the funding would be reserved for projects applying to serve youth experiencing homelessness. Now, this alone is not going to guarantee that youth are served through Homekey. It has to be this in combination with other strategies. Some of those we'll talk about in a second, but this is certainly a key part of the strategy. So this next recommendation is prioritize Homekey funding for jurisdictions with high levels of youth homelessness. So here's another part of the equation here. So in addition to low overall rates of funding directed to unaccompanied homeless youth, Homekey funds were not awarded in all parts of the state with high rates of youth homelessness. You saw of the 10 jurisdictions with the highest levels of youth homelessness, one did not receive any Homekey funding. That was Watsonville, Santa Cruz City and County. And so, to remedy this, HCD's application scoring process, could prioritize jurisdictions with higher levels of youth homelessness by one strategy would be by awarding additional points for applicants from these regions that have high levels of youth homelessness that are specifying their service population to be youth. So we have a few more recommendations. I'm going to pass it back to Anna to finish these recommendations.
Thanks, Simone. So our recommendation here is to expand Homekey's eligible uses to include supportive services for youth. As mentioned earlier, for many people experiencing homelessness, it is important that services are provided along with housing. More than 1 in 4 projects awarded Homekey funding, so 29%, included the provision of supportive services by drawing on additional funding sources. Homekey's eligible uses should be broadened to include the provision of supportive services in order to provide case management, assistance with substance use, mental health, education, and employment services, connection to public benefits, especially during the pandemic. Those have been crucial for supporting people, and youth have a particularly hard time navigating the public benefits infrastructure and understanding those processes. And there are other services to facilitate retaining housing and gaining self-sufficiency that are critical for youth. For youth, the addition of supportive services as an eligible use of Homekey funds is particularly important. Unlike adults for whom there are multiple sources of HUD funding to address homelessness, in addition to state-funded programs, federal funding for services for homeless youth is extremely limited, and therefore the opportunity to braid Homekey funding with existing programs to offer services is less accessible for projects serving youth. Next slide, please. Provide technical assistance to educate homeless youth providers about Homekey funding and to help them apply. So, given the range of eligible uses, Homekey could play an important role in addressing youth homelessness in California if Homekey funded projects intended youth as their service population. So HCD could provide technical assistance to local jurisdictions to increase awareness about the potential use of Homekey for serving youth. Providers serving youth experiencing homelessness could partner with their local cities, counties, or other public entities to apply for Homekey funding to serve youth. And many existing programs serving youth utilize master leasing of scattered site housing, which is an eligible use of Homekey funding. So while supportive services are a key element of any successful program for unaccompanied homeless youth and are not currently an eligible use of Homekey funding as previously mentioned, 29% of those funded projects included supportive services by drawing on those additional resources. So a similar approach could be taken in Homekey projects serving youth. Although funding for addressing homeless youth is limited compared to many federal and state funding streams geared towards adults, there are a handful of state resources to draw upon to fund supportive services, and those do include the County Administered Transitional Housing Program Plus, the Transitional Housing Program administered by HCD, HAP funding that Simone has been discussing, administered by the HCSC, and the Homeless Youth Emergency Services and Housing Program administered by the Office of Emergency Services. All right, next slide. Okay, establish ongoing funding to address youth homelessness. While one-time investments in addressing youth homelessness are a significant step forward, they do not eliminate the need for a permanent source of funding for addressing youth homelessness at the state level. Ongoing funding is needed to support a continuum of programming for homeless youth across the state, including shelter, rapid rehousing, and permanent supportive housing. One such approach is that of the Bring California Home campaign, which calls for California to annually invest $2.4 billion in new funding for solutions to homelessness and requires that at least 10% of funding is invested in addressing youth homelessness. You'll hear more about that later from Sharon Rapport. Next slide. All right, so this is the last phase of our presentation. So first we'll discuss proposals considered by the legislature and how you can take action right now to prevent and address homelessness in California. And then we'll move into a Q&A session. Next slide, please. All right, so everyone on the webinar this morning, there are two ways that you can help address youth homelessness today, above and beyond what we know you already have been doing for young people. So first, we're asking you to submit letters of support for bills and to sign on to budget proposal letters that will increase funding and resources available to address youth homelessness. Second, John Burton Advocates for Youth is conducting a youth survey right now for youth ages 18 to 24 to see how the pandemic is impacting their lives right now. So if you could please help us circulate that to youth in your organization or district or area, that will help us ensure their needs are raised up to the legislative and administrative decision makers who determine how to use pandemic relief funds. Next slide. All right. So John Burton Advocates for Youth is leading a budget proposal to dedicate 10% of state homelessness funds to youth, as we've mentioned today as our recommendation. The letter here that is linked requests a minimum of 10% of the state's fiscal year 2021-2022 spending on homelessness, including the Homekey funding that is proposed in the governor's budget, be dedicated to addressing homelessness among youth. To support the proposal, you can click the link here in the presentation, and I'll put it in the chat in just a minute. And it takes just 1 minute to fill that information out and maybe add a logo to that budget letter. Simone, I'm not sure if Sharon was able to join us this morning to tell us more about the next slide about Assembly Bill 71 and how to support.
Yeah, I think, she had tight scheduling. She was going to join us right at 11. It's 11:01. So why don't we move on to the next slide, and we can circle back to AB 71 at the end of these slides. And if she's not on, we'll cover it. And if she's on, then she'll cover it.
Sounds good.
So I'll cover this slide. Excuse me. So this budget proposal is very similar to the first one that you saw that Anna just discussed. It's just a different percentage ask. So this is California Coalition for Youth requesting that 25% of the state's funding for homelessness be dedicated to addressing homelessness among youth. And so to support this proposal, you actually would email Kim Lewis with CCY to sign on. So you email her directly. And then the next two proposals that we'll mention, the last two that we talked about were specific set-aside requests. They are, requests that any funding for youth homelessness be put, that their percentage should be put toward addressing youth homelessness. The next two proposals are really broader, or different approaches to addressing youth homelessness that don't include a specific set-aside amount, but are instead a specific funding directed specifically towards youth homelessness. And so this one is AB 413, and it's authored by Assemblymember Phil Ting. We are sponsoring this proposal, and it focuses primarily on homelessness among current and former foster youth. And it has 4 provisions. You can see there on the screen. It establishes some training requirements, and then it makes 2 programs permanent, the Housing Navigators Program and the Transitional Housing Program. And then lastly, it establishes a housing supplement for the THP Plus program. And you can submit a letter for this bill by visiting our website at the address on the screen. And then there's also a budget proposal for this, and you can sign on to that budget proposal at the JOT form address. This next proposal is AB 234, and this is authored by Senator Wiener and sponsored by the Alliance for Children's Rights, Children Now, and California Coalition for Youth. And this bill and it's also known as the Support Act. There's a bill and then also a budget proposal similar to the last. And the proposal would provide $100 million in new funding to increase housing infrastructure for youth experiencing homelessness. So basically, it would create a forgivable loan program to be used to create new housing or acquire existing housing for youth between age 16 and 26 who are currently or formerly in foster care, are experiencing homelessness, or are youth under probation supervision. And then a portion of the funds would be specifically targeted for youth in foster care, age 18 to 21. And in order to support this proposal, you actually just email Kristen Power directly. Her address is on the screen to get the support letter or to sign on to the budget letter. So now I'm thrilled to see that Sharon has joined us. We're going to go back a little bit to AB 71, and Sharon is going to talk for a few minutes about this significant, huge coalition of people working on this proposal or this campaign. Sharon,
Hi.
are you able to? There we go.
Yes, can you hear me okay?
Yes.
Okay, great. Okay, thanks so much, Simone. Hi, everybody. I'm Sharon Report. I'm with the Corporation for Supportive Housing. We're a national nonprofit, and we are working in collaboration with John Burton Advocates for Youth and about 200 plus additional advocacy elected and nonprofit entities supporting AB 71. This is a bill that was created by the Bring California Home Coalition. We have a steering committee of about 16 different members, and JBAY is part of the steering committee along with my organization. And the whole concept of the campaign that we call Bring California Home and through AB 71 is to dedicate specific revenue sources toward addressing homelessness. So the bill would create 2 new revenue sources that would raise about $2.4 billion a year. And those 2 revenue sources in generating the $2.4 billion a year would then allow us to dedicate funding toward housing and services for people experiencing homelessness. And it does include a 10% set aside for youth experiencing homelessness. There's a lot to the bill, including the money, the ongoing nature of the investment, some accountability provisions to ensure that locals are using the money in the right way. There would be data requirements to really look at data around need, geographic need among populations, and to be steering dollars toward that need and evidence-based and best practices around housing and services. This is a huge effort. So the reason why we have over 200 different organizations as part of the coalition is because we really are trying to gear up toward having a really impactful number of organizations to be pushing for this. Passing new revenue sources at the state level requires a 2/3 vote of the legislature and a signature by the governor, and that's extremely difficult to achieve. We do have this bill, but we're also working through the budget process to get the revenue sources passed at through the budget process, and to get the policies incorporated into the budget trailer bill language. So we are asking people to submit letters of support. And on the PowerPoint slide, you see the link to be able to submit the letter of support. And we have on that link a sample support letter. And then we also have a budget letter that we're asking people to sign on to. In addition, we really want people to be turning out for every opportunity to talk about this bill. So in budget hearings around housing and at the hearing that's going to be held, the first policy committee hearing that's going to be held on the bill, we're asking people to just call in to those hearings and to weigh in support. And if you let us know that you are interested in doing that, we could even text you a message when it's time to call in, so that you're not sitting on a phone line waiting for hours for this item to come up. But I think what we're trying to get to is just generating as much buzz and support for both AB 71, the bill, and the budget items so that we can get this ongoing funding that we think is so critical. So I'll stop there and would be happy to take questions during the Q&A session, but I appreciate everybody being on this webinar and supporting this bill. Thank you.
Oh, there we go. Yeah, so during the Q&A session, of course, like I said, please continue to submit questions throughout the presentation, and both about HAP, Homekey, and if you have questions about these proposals. I do just want to say there were a few typos that we noticed on the AB2 or the SB 234 slide. One being that it says AB 234, and it's actually a Senate bill. Senator Wiener is the author, which would make it an SB 234, and another little typo. We will fix those, and when we send out the slides to everyone, that slide will be fixed. So I just wanted to say that. So moving forward to the last slide here. So Anna mentioned a survey that we are conducting. So we are surveying youth who've experienced foster care or homelessness about their current experience related to basic needs security, housing, and other areas. And we're asking for responses by March 26th, so later this week. It's an anonymous survey. It's very brief. It takes about 5 minutes to complete. So if you know youth who are 18 to 24, who have been in foster care or have experienced or experiencing homelessness, please circulate this survey. Respondents will be entered into a raffle to win one of 10 $50 gift cards. And we're using the survey results to continue to advocate for resources to assist and protect youth. So that's the purpose of the survey. And it says someone's asking, can we send another email out about the survey to send around again? Absolutely. So we'll, along with the follow-up email with all the webinar materials, we'll send out an email that can be circulated with the survey information. And then someone also asked, and I guess what I'm doing is we've moved into Q&A without me announcing it. So let's do it formally. Let's move into Q&A, question and answer. And I'm going to just put on the screen there both Anna and my contact information so that if questions come up at a later date, you have that there. But please do continue to enter questions into the control panel, and we'll spend another few minutes answering those before we close. So, would you send the link to the survey in the chat? Great idea. Anna, are you able to put the survey link in the chat? And someone asked, will we be sharing the results of the survey on our site? That's not something that we can. We absolutely can. We were going to certainly put something out with the survey results, so we can go ahead and post that on our website. Let's see what other questions we have here. Could you add the Google Docs in the chat so we can access? So I assume you are asking for the links to support. So what we'll do is we will include all of those in the follow-up email so that you have them all in one place, so that when this control panel goes away, when the webinar ends, you don't lose all of those links. One question that we have here is, which definition of homeless youth are you using, or which definition of youth are you using? And it looks like, Anna, do you want to answer that? It looks like you may have also answered this in the questions box to the person individually, but do you want to answer that just for everyone?
Just had to unmute myself there. There's a little bit of feedback, so let me know if you hear anything. Yeah, so we have a definition of youth homelessness that follows the federal McKinney-Vento definition. So youth who are unaccompanied, ages 12 through 24 inclusive, so under age 25 is how we define unaccompanied homeless youth. And we also use the data from those figures that are in the report. It cites the HUD point-in-time count data. So that's how we kind of arrive at those percentages, and that's what we mean. So it's kind of counted differently for if it's a family experiencing homelessness and children are with their parents, that's counted differently than a youth who is not accompanied, meaning without parents. So thanks for that question.
Thanks, Anna. So someone asked, is it basically they're asking, is it possible that youth could have been served, in other Homekey projects that didn't specify youth? Yeah, so I think we kind of, alluded to this in the presentation, and let's talk a little bit more about this. So two Homekey projects out of the 94 that were funded and that applied specified youth as a service population. There were projects or there were services or projects that were serving youth kind of explicitly. Now, all of the other projects, specified service populations that didn't state youth. So it could have been, people experiencing homelessness, which is a very obviously general category. Now, could youth have been served through those projects? Absolutely. They weren't excluded, like they weren't allowed to be served. But what we do know is that largely they were not served through those projects. So we know that both just from, we're asking jurisdictions whether they served youth with Homekey funds, and the response we got was, largely no. And we also know kind of just historically that when youth are not, the intended service population, they don't tend to be served. So to answer your question, yes, it's absolutely possible. Do I believe that youth were served in other projects? I'm sure that there were cases where they were. And in fact, HCD at a budget hearing recently said that they think there was about, 20 or so projects that may have touched youth. There may have been, small numbers of youth served by those projects. But again, what we know is that they largely were not served through Homekey projects, with the exception of the two that specified youth as the service population. So the next question is, could providers combine Homekey funds with HAP funds? Anna, do you want to take this one?
Yes. Let me just make sure I'm unmuted. Can you hear me?
Yes, we can hear you.
Oh, okay. So we do know that in the current Homekey project awardees, of those 94 projects, about 29% of them did find another source of funding. And so we did mention that there are existing youth programming funding streams where youth are served or could be served, and should those youth providers kind of partner and apply in a next round of Homekey to provide the services with that funding for acquisition, absolutely, we think that youth could be served. And in fact, some people did do that for their service populations, where they found another source of funding like HAP, like that more flexible youth funding that included services as a youth, and they were able to do so in that way. A couple of sites mentioned that they purchased a building that was located near services, but didn't explicitly describe funding for services attached. But there was some attempts for people to use Homekey to do both the services and the housing, which is so critical.
Thanks, Anna. So if you have any last questions, go ahead and enter them now. I think the rest of the questions we've kind of answered privately. They're more logistical questions about if the presentation is going to be sent out. Yes, it absolutely is. We will also post it on our website. And so I'll just give it a couple more seconds to let people type in any last questions before we close. All right. Well, thank you everyone for your time this morning. We hope you have a great rest of the week. And if questions arise for you after the webinar, please reach out to Anna or myself. And if you also have thoughts or comments about how youth can be, served in Homekey, we'd love to hear them. So do reach out about that as well. Thanks everyone, and have a great rest of the week.